Alright everyone, we're going to be going over the manual or how to use the Lifeloc FC20BT. This is going to be our new breathalyzer we're going to be utilizing. This manual will be located in the lab. I do have highlighted the areas and the pages that we're going to be going over. The automatic test is here. You're going to have a manual test, a passive test, printing test results. And then I have the tabs here where you can find everything. We're going to go over how to turn it on, so I don't really highlight that one because it's fairly simple how to do. So what you're going to need is you're going to go and look for this box. It's going to be located somewhere in the lab, Pelican cased. So all you're going to be doing is going to be opening this bad boy. What you're going to be needing, or what you're going to get in here, is your printer, your breathalyzer, and the straws that the patients will be blowing in. So what you're going to do is you're going to go ahead and power on your printer, and then the second is you're just going to be pressing the power button on your breathalyzer just once real quick. Doesn't need to be held or anything like that. Make sure the date and time is correct, and then it's going to automatically switch over to auto test. Now we're going to go over the auto test function. The auto test function is a patient normally that would be compliant, that isn't short of breath, or the patients that you would want to get to give you a sufficient amount of oxygen through or breath through the straw. So you're gonna go ahead and take your straw. Gonna go ahead and crack this bad boy open. Super hard to do one-handed. This straw is going to have two holes, one here, one here. If you flip over the machine, you're going to have two ports. You're going to have one bump here and one bump there. This is where these holes are going to go. And the little edge here is going to go on away from the left-hand side, I believe. Okay, so you're gonna go ahead and just push those bad boys in. It doesn't make a clicking noise or anything like that. And then now you're gonna have it this way. So the straw that's going to the patient is gonna be facing the left, and then the detaching little lever is gonna be on the right-hand side. So for the auto test, all you're gonna be doing is going to be putting, just like we do our normal breathalyzer now, you're gonna have it like turn it on. And then ours waits till you count down to 0 or whatever. But this one, all you have to do is to tell the patient to blow in it until you hear a beep. So I'll demonstrate. Hear a beep. It results your 0.000. And then to print, all you're going to be doing is make sure you have your printer on. This button that says execute, it has a printer sign right above it. So all you're going to be doing is going to be hitting that printing sign. You don't have to be near it. At least I don't think so. I haven't tested that. But all you're going to be doing is be printing, and then it gives you your results there. The units, it's a blood alcohol concentration. The auto test number, so this is the 15 tests we've run on it. The results are 0.000, and then the date and time. Now we're going to go over what happens whenever we test it into a manual mode. The manual mode would be for patients that basically are kind of short of breath, or patients that don't really want you to find out, I guess, what their blood alcohol concentration is. So they're the ones that kind of give you like the little puff of air, and it doesn't register on our other one or this one on the auto test. So what you're going to do is you're going to go to function. You're going to switch it over to manual. It's going to be, say, manual test now. Now with the manual test, you're going to say they give you 2 seconds of air through the straw on right when they're near the end of their breath or near the end of exhaling. You're just going to hit execute, and it's super sensitive. It'll grab the sample and it'll tell you what the blood alcohol concentration is. So we'll kind of go over that real quick and just show you. So say I'm the patient, we're going to go ahead and I don't want to give you a full breath or a long enough breath. We'll just hit it pretty short to the end of their breath. So you're just going to have to kind of watch them and kind of like be pretty quick with it. Not quick, but you're going to have to be, you're going to have to observe everything. So you hit it at the right time. So see, and it still results in a blood alcohol concentration, even if I didn't want to give a full breath. So this could be for the patients, like I said, that are not compliant, they're kind of out of it. I'll let you be the judge of that. And then to go back to the main menu, you're just gonna hit the power button once. It doesn't turn it off, it just goes back to the main menu, and it always goes to auto test. So you're gonna, and then the next test we're gonna do is the passive test. The passive test, you don't need the straw. You don't need the straw. So all you're gonna be doing is using the back side of this. You're gonna be pointing it 4 inches away, or holding it 4 inches away from their mouth when they just kind of like let a breath out, or even like lets some air out or exhale. This is the port, so this is what you're going to be testing with. So all you're going to be doing is whenever they exhale or just breathe out, you're just going to be pressing that sample button. And all it is going to tell you if it's negative or positive for alcohol, or if they're negative or positive for ETOH. So it's just going to, quick example. Quick little negative. And then, like I said, if you want to print it again, you hit the print, and it'll tell you negative or positive. This one doesn't give you actual numbers. And if you guys have any questions, as a quick overview on how to use this Lifeloc FC20 Bluetooth. So we're just gonna menu, go back, and then we're just gonna power it off. And then whenever you put this away, make sure you power the printer off as well. Put this bad boy back in there. Tear off the paper if the doctors need it, or if we need to put it on anything.